Hey, so good morning everyone. Good afternoon, thanks for coming. We have a truly exciting presentation today. We're going to be talking about stem cell therapy. And I'm glad you're here because stem cell therapy is relatively new. We've been using stem cell now for, I would say, the last 20 years, and in the last 5 years, it's been used for more and more degenerative disease, particularly joint disease. And I'm going to go through how stem cells are harvested and how it can truly prevent pain and heal your joints from ligamental tears, from arthritis, from inflammatory conditions. It is truly a godsend. All right? Okay. So as from time to time, we've been looking for the fountain of youth. And every now and then we'll come across a really good intervention that holds a lot of promise. We have not found the fountain of youth. However, stem cell therapy, bioidentical hormone replacement, nutritional therapies, and things that God put on this earth are there to preserve our youth. We don't have the answer, but we certainly are moving towards making people live healthier lifestyles as we get older. Now let's look back. What we see here is that in 1700, the average life expectancy was 30 years. 30 years. In 1800 and 1900, we went up to 50 years. Today, we're at 78 years. That's the life expectancy. So we must be doing something right. If you look at the interventions in healthcare, from medicines, surgery, but most definitely lifestyle is very, very important. And infrastructure. We're not dying from infectious diseases like we did in earlier years. We now have antibiotic therapy, and we have cancer therapy, and so on. So it's a good thing. We're living longer, but is it really just the length of time that you live? Or do you want to have good mobility? Do you want to have quality of life? So this is where I think stem cell therapy holds its place. Essentially what's happening is that as we get older, we're outliving our cartilage, the cartilage in our joints. So we're developing narrowing, and it's wasting away. And what that creates this problem, arthritis is extremely common. You don't want to end up in a wheelchair having to use walkers and so on and so forth. So if that does happen and as you get older, trauma in life, if you've had a car accident or if you fall, those things are going to create a more rapid acceleration of the aging process. So stem cell will definitely help with that. Now, traditionally, what do we do as doctors when we're treating osteoarthritis? We use drugs. Drugs and more drugs, right? Most drugs have side effects. What's a common side effect of an arthritis medicine? Does anybody can tell me that? What is a common side effect? Say you're taking an anti-inflammatory drug. Can anybody tell me? It affects your kidneys. Perfect. Anything else?
Bleeding.
Bleeding, yeah. So your GI tract, it can cause bleeding internally. It can cause kidney damage. Some of them can cause constipation, and if you're on an opioid, you can get very constipated, or you can get diarrhea, you can get nausea. There's quite a few side effects from medications. And essentially, this is where we end up with some of the medicines that we take. gastritis being one of them. All right, now, what you see here is a joint. This is a knee joint. And you can see that there's some space in this joint, but when you look at this one, there's hardly any space. As you get older, the joint space narrows. The cartilage wears out. Traditional medicine, we use a lot of injections. We'll use steroid injections. And steroid injections are no different than oral medication, the medication that we use. They can cause wearing of the cartilage long term, and it causes bone resorption. So you're losing bone, you're losing cartilage. You may feel better for a while, a month, 2 months, even 3 months if you're lucky, but essentially you're not making the situation better by using steroids. And you want to do that no more than twice a year. The other option is surgery, joint replacement therapy, where they actually go in and they cut the top part of the bone, they cut the second part of the bone, remove that arthritic portion, and then put in artificial joints. Now, when you do surgery, there are certain risks with surgery. You have anesthesia risks. Some people who go under anesthesia, they actually develop a syndrome where they lose their memory after they come out of anesthesia. So it's not something that we want to look forward to. It's very invasive. And then the rehabilitation time, the time it takes you after you've had that joint replaced, can be as long as 6 months, it could be a year, or I've seen many of my patients, they never recover from that rehabilitation process. Their knees constantly swell and they're in pain and they wish they've never done it. So I am not advocating surgery either. Even with robotic surgery, and these are the state-of-the-art equipment where the doctor doesn't even have to be there. He can be in a little computer lab utilizing all these little equipment, and you're there as the patient prepped. But even that requires you to have medical clearance, and in advanced age people, anybody over 60, there is significant risk associated with it. Okay? But there's the hope. This is a stem cell. A stem cell is what we call a mononuclear cell. It has one nucleus in it. The benefits of stem cell is that they can divide and they can differentiate. Those are the two things that make a stem cell a stem cell. Differentiation meaning that it can change into almost any other cell in the body. So if you have a problem with your cartilage, it can change into cartilage. If you have a problem with ligaments, it can change into ligaments. And stem cells, from the time that we're kids, we were just born, stem cells is what forms the different organs in the body. They form the brain, they form the bones, they form muscle, they form skin. So stem cells are what, as babies when you're born, you have plenty of them. And I'm going to show you some numbers in a minute, but when you're younger and you're an infant, or just being born, a newborn, you have one stem cell to every 10,000 cells. And that just goes down as you age. And I'm going to show you those numbers. So when you do stem cell therapy, though, you don't require, there's no medical clearance. You don't have to get all this fancy labs and go through stress tests. It's just an injection into a joint or into the blood. Okay? So it's a quick thing. It takes about 5 minutes if you're just going to do the injection. But if you're going to do it with platelet-rich plasma, and I'm going to tell you a little bit about that, it'll take about 30 minutes. Because then we pull your blood and isolate the platelets inside the blood, mix it with the stem cell, and then inject it in the joint. And when you do that, you have a better chance for the stem cells to do their job, because you're creating the right environment for the stem cells. All right, so let me tell you what stem cell is not. You may have heard so many things on the news about what stem cells are, and you may be confused about stem cells. But I want to remove all that issue. Amniotic tissue are dead cells. This is a fetus, and that's the placenta right there, and you have the fluid here. What some doctors are proponing, or saying rather, is that the amniotic fluid cells are stem cells. But they cannot, those cells are dead because they cannot divide and they can't differentiate. So don't be fooled by thinking that amniotic cells can do what stem cells can, because they're not truly stem cells. The other thing is the platelet-rich plasma, and this is the opportunity I'm going to tell you what that is. In our body, in your blood, right now, you have platelets. And platelets are tiny little particles of cells that have what we call granules in them that causes the body to heal. They have growth factors. We have that now. You have it at 60, you have it at 10, you have it at 100. You still have, when you have platelets, you have those things that are floating in your blood. If you should get cut, the first thing that's going to happen is that the platelets in your blood rush to that area to plug so you don't exsanguinate and bleed to death. So platelets-rich plasma, what we do with that is that we isolate, we draw your blood, we spin the blood down, remove the red blood cells, and then isolate the platelets. Once we have that platelet-rich fraction, we have all the healing powers of the body in that platelet-rich fraction. But there's no stem cells there. Okay, and the older you get is the less stem cell you're going to have in your body. So it will help to get the stem cells to work, but it's not stem cell. So stem cells are not PRP. And this is what I wanted to show you here. So stem cells are really the building blocks. This is a newborn. This baby has more stem cell per body weight than his parents or his grandparents or his great-grandparents. So when you're younger, you have a lot more potential for your body to heal itself. So young people, you may notice that when a kid cuts themselves, within a day or two, they'll heal. They'll be able to take the Band-Aid off. But it may take you a week or two to heal, because you just don't have enough stem cell in your body. So literally, stem cells can form any tissue in the body. We are showing here the hips and we're showing the knees, because those are two very common areas that as you get older, especially if you're overweight, you're going to develop arthritis in these joints, the hip joint. And also the bones, as you get older, become more brittle, osteopenic, osteoporosis. You can get fractures and so on. So these are the two main joints. But you can get arthritis of the spine. You can get a herniated disc. The spine can compress. You can have shoulder issues. And we can inject stem cell in all these joints, even your hands, your wrists, your ankles, all those places. What I mentioned before, this kid, 2 days, he cut himself, it's healed, he's removing the Band-Aid, but for us it'll take us about a week or two. Now here's what happens. Here's some numbers. This is just graphical so you can see. As a newborn, this is the amount of stem cells that you have. Unlike, as you get older, you get smarter, right, and wiser. But as a teenager, let me give you some numbers. As a newborn, for every 10,000 cells you have one stem cell, 10,000. You think, oh, that's not that much. But as a teenager, for every 100,000 cells you have one stem cell. Then as you get older, to the point where you're 80 years old, for every 2 million cells you have one stem cell. So you can see it's like the law of diminishing returns. You know, the older you get, is the more stem cells you lose. And then essentially your ability to heal, to regenerate, goes down with age. So we have a lot to look forward to. So here's the deal. You need to understand that. We still have parts of our body that has a higher number of stem cells in it. What part of the body, and this is a nice question for you guys, what part of the body do you think you have stem cells right now? Anybody can tell me? Where do you have most of your stem cells in your body?
Brain.
The brain? I wish. No, I wish, because that's actually one of the places where you have the fewest, because it has the less ability to regenerate in the brain tissue. But what part? I'm going to wait and see if you can answer. You want to try?
I don't know.
Okay. The hands? No. All right, it's the bone marrow. The bone marrow, where most of the cells are made to go into the blood. You have the bone marrow has the greatest proportion of stem cells. Have you guys ever heard of a bone marrow transplant? Yes. That's why they use bone marrow, because those stem cells that are there, they can take them out, kill off the cancerous cells, the leukemic cells or the lymphomic cells, and then put those stem cells back. It grows and it can cure the cancer, correct? So bone marrow is one place. The other place you'll never guess, but it's fat tissue. That big old room space, it takes up a lot of space thing. It's got stem cells in it, embedded in it. Inside the lining of every fat goblet, you have stem cells. So those are the two places. So what modern medicine tries to do, they tell you, okay, well, use your own stem cell. So we'll do a bone marrow, which I was trained to do, and we've done bone marrow stem cell. Actually, the process takes about an hour, and it's really not painful. You know, once you numb the area up, it's not painful. You just pull out some of the bone marrow, and then you have to process it to isolate the stem cells that are in there. That process is less cumbersome as the fat. How you get fat? You have to do liposuction. So you make a little incision under local anesthesia, and you suck out fat. Who wants some fat sucked out right now? I thought I'd get some volunteers on that. But no. It is invasive, because you still have to do that. You have to dig into the bone, pull the marrow out, or suck the fat out. So it's more invasive versus umbilical cord, the blood of the umbilical cord of a brand new baby. That's the cord, not the baby. We don't use any fetal tissue, and I'm going to get into that. It's just the blood on the umbilical cord that's loaded with stem cells. And those stem cells are young, they're fresh, so they're more powerful, and they can divide more, and they can differentiate more. They have the ability to do all of that at an extent that's about 1 millionfold of an adult stem cell. So your own stem cell is just not going to be as good as the umbilical cord blood, not the tissue, the blood. And right now it's approved, because if you bleed, say you take an aspirin and you have a GI bleed, and you become anemic, you're getting blood from a blood bank. They're giving you blood from a blood bank. It's not your own blood. They're getting it from allogenic, from another person, the blood, that people donate blood. It's no different than that from the cord blood, or you're just getting the blood, so there's no adverse reaction that you have to worry about, like a rejection. You don't have to worry about that when you're using umbilical cord blood. They're immune-privileged. They do not create a reaction in the body. Okay? So this fella, it looks like he's not very happy. He just had bone marrow. No, I'm kidding. No, but it's essentially, you know, it's a procedure that you have, and you still have a little bit of a rehabilitation process involved with it. You have to nurse it. Now, what happens also when you have bone marrow, it's less of an issue than fat stem cell, is that when you suck that fat out, you have all these other stuff. The stem cells are embedded in those low linings of the fat cells, so you have to process it. And recently, the FDA came out and said the processing of fat cells to get the stem cell is no good. You're doing too much on it, and it's not considered minimally manipulated. It's now considered you can't do it anymore. So you can't use fat cells, so what they're doing is just injecting actual fat in your joint because of the processing. So that's not a good option anyway. So, and it'd be like, this is supposed to signify, instead of purity, you know, you're getting all the other junk with the stem cell, and you wouldn't drink this water if it looked this color, would you? Okay. All right, so stem cells adult stem cells, she's having a nice cocktail there. He's having one over there. Cocktails are good, but alcohol, when you get older, we know that alcohol can cause DNA damage, right? So your stem cells is not going to be as good as an umbilical cord blood because those damage, even from sunlight. Sunlight can damage your DNA. So your stem cells could never be as pure and as strong as the umbilical cord stem cell. Now, I do the bone marrow for people who are younger, under 50, if they want their own stem cell. But it's much easier to purchase the umbilical cord blood cells. I'm going to show you what the processing of that takes, and to be able to inject that into the joints to regenerate the cartilage. And I'm going to show you some slides on that, how it works and how effective it is. Where's my slides? Did battery die? So, yeah, so umbilical cord stem cell, by all means, is a much better, because of the age of them being as young as they are, and their ability to grow and differentiate. What happened? Okay. Right there. No, further, much further than that. Let me try it. Okay. I'll catch up. Mm-hmm. All right. Okay, so the last reason why it's better to use umbilical cord blood cells versus your own body cells is that you have much less and they're not as strong. When you're old, when you're young. This is important. Umbilical cord cells can divide, they double every day. As you get older, your adult stem cells will divide every 4 days. So it's 1/4 as strong. Cord blood cells divide every day. So one of the things I have to differentiate is embryonic stem cell. Embryonic stem cell is actually from aborted fetuses. That is illegal, right? They know that when you're young, your stem cells, you have a lot more stem cells. That is illegal. That was made illegal back in 2000. And so that you can, if anybody tell you they have embryonic stem cell, run in the opposite direction. That is not what you want, because it is illegal. And for ethical reasons, you don't want to use fetal tissue. It's just not right to do that. So, you know, not that they're not good cells, but it's not an ethical thing, so it's been deemed illegal. Okay, so this is what happens with the umbilical cord blood. A woman is pregnant, and it's deemed that she's going to need a cesarean section. She signs a consent that she's going to donate her placenta, or the umbilical cord, to science. They check her history, her medical history, her social history, to make sure that nothing in her background could produce a communicable disease. As soon as that baby is born, they remove the baby comes out, the cord is then detached, they then aspirate, get the blood, and then the blood, they test the blood for all communicable disease. And then the processing is very, very simple because it's just blood. So they just have to spin down the blood, remove the red cells and the white cells, and they're left with the stem cell. Very simple process. And there's two different agencies that regulate this in the United States. The FDA regulates it, and the Tissue Bank, the American Association of Tissue Bank, they regulate this stuff as well. So it's a very highly regulated process, and obviously for sterility and for communicable diseases, it's checked out thoroughly. Okay, so because the umbilical cord has a high ratio of stem cells to other cells, it doesn't contain other tissues, so there's no debris that contains in that stem cell harvesting process. The umbilical cord must be treated in compliance with the American Association of Tissue Bank regulation, and I'm repeating myself because I want you to understand that it is rigorously tested. The sterile cells are then extracted, they're frozen at minus 196 degrees Celsius, so they're frozen immediately. This freezing process slows down the metabolic activity of the cells, and so when we order the stem cells for you, those stem cells are shipped on dry ice, very, very cold, and it's shipped overnight. So if you had an appointment on Tuesday, it's shipped Tuesday morning. So, and then it takes about 4 or 5 minutes to thaw it out, and basically you just thaw it out by rubbing it in your hands. The body warm thaws it out. Immediately once it's thawed, we don't wait. We mix it with your PRP, and then we inject it in the joint. In the shoulder, in the knee, in the hip, in the back, whatever ails you. Okay, so it's a very quick process. It does not take it, and you're in and out. You can go to work the same day. There's no anesthesia, there's no surgery, so it works. And here's how it comes in a vial. We basically would pull it out, we mix it with your platelets, and we inject it. You leave with a little Band-Aid. Simple. It's simple, it's reliable, it's straightforward, and it improves the quality of life. It increases your mobility, it increases your strength, and you avoid the risks of surgery, of rehab, going through physical therapy, and side effects associated with surgery. So let me answer a few more questions that may be going through your head. You're thinking of what I'm saying. So I'm going to guess. Where is it done? It's not exactly a bright picture, but we do everything right here at the Anwan Regenerative Center. You don't have to go to an outpatient center. You don't have to get prior authorizations. You don't have to get a medical clearance because it's just an injection locally. Okay? It takes 5 minutes if we use saline, but I don't want to use saline because saline will kill some of the cells, and I want you to get all of the cells that are there. Saline is an isotonic solution, so we use your platelet-rich plasma, which is normal with your body. So we take some of that off, mix it together, and then inject it in the joint. Anyone can be treated. The stem cells are classified as immune-privileged. They do not cause a reaction. I said that earlier, I'm going to say it again. You don't require any medical clearance because there's no anesthesia involved, and it is not stressful on your body. You can do this in a single visit. You can come, you bring your MRI or whatever you have, we review your medical history, and we can give you the injection at that time. We can give it in your shoulder for rheumatoid arthritis, psoriatic arthritis, gout, tendonitis, bursitis. That all works. If you have tears, rotator cuff tears, it's excellent for. You don't have to undergo surgery for that because the stem cell will heal it. You can put it in your knee. This is a very common area, osteoarthritis of the knee. It can actually regenerate your cartilage, and I'm going to show you an MRI that shows how the cartilage grows back with stem cell. You can put it in your spine. You can inject within the disc space the stem cells, and it can regrow that cartilage there. You can put it in the muscle if you're having lower back pain. You can do an intramuscular injection of stem cells for sprains and strains and tears, muscular tears. So it's going to heal you. Okay, now for certain systemic disease like rheumatoid arthritis, lupus, all those anti-inflammatory autoimmune disease, you can take stem cell intravenously because stem cell will reduce the inflammation in your body. Because those cells are immunoprivileged, they do suppress inflammation. And so many centers are using stem cells to treat rheumatoid arthritis intravenously. And here's a picture of an MRI. Now, this is the knee joint, and what you see here is the femur bone, the top part of your leg, and you see down here, this is called the tibia bone. And in between, you're supposed to have this padded cartilage here that makes it so you don't have bone on bone. And what you see here, this is after 3 months, you can see that this is all worn out, it's dark, there's very little cartilage, versus here, after 3 months, of the stem cell injection, you can see the increase in the cartilage that's grown over that period of time. And this corresponds to symptoms there and there. So not only are you seeing radiographical changes, you're getting symptomatic improvement as well. This is after a year. This is that same patient. You can see how it was when he first started. And now look at this, look at the depth of this cartilage that's grown in 12 months. This is a patient that has rheumatoid arthritis, vasculitis, and you can see all these rashes here. And with treatment, intravenously, you can see all the rash is gone. Okay? So other questions on your mind would be, what does it cost? Or, will my insurance cover it? Who had those questions? Yes and no, right? So, as a basis for comparison, stem cell treatment that is performed by harvesting, by doing a bone marrow, or by getting the liposuction to get the fat, it ranges between $8,000 and $15,000. But we here, since we're using primarily now umbilical cord blood cell, for a small joint, we think it would cost about $3,500 for a small joint, and for larger joints, for most large joints, it's about $5,000 or $4,900. That is what it costs. Now, if you have more than one joint to treat in that visit, the price goes down by 50% for that second joint or third joint. Now let's compare stem cells to, this is a stem cell, this is for a knee joint. For braces, nowadays it costs you about $6,200. To get your eyes fixed with LASIK, it would be about $4,000 per eye. So, you guys may have questions about you individually, but privacy law prevents me from answering those questions in a public setting like this. So what we would like for you guys to do is to know that by attending the seminar, you get a free consultation, because that consultation will go towards the price of the stem cell. When you come in, we will review your MRI, review your X-ray, your ultrasounds, we'll do the consultation, and then we'll set the date for the injection. Okay? Now, we're also giving $500 off the treatment because you're here today. That's 10% off if you schedule, but you'd have to schedule today to get that $500 off. So essentially, stem cells is a way of the future. Most people are looking into it. It offers this wonderful opportunity to heal your body naturally, without surgery, without drugs, without rehabilitation, and absolutely no side effects. So in the back we have Laura, we have Hope, and we have Shab, who's available there to talk to you about getting you on the calendar for an appointment. And this is the rest of our team. We have, this is my wife, she works with me, she's a family nurse practitioner. We have Dr. James Velos, who's my postdoc, and we have Dr. Webby, who's also a postdoctoral intern. And these guys work with me, and we pretty much have a real solid team. And right at this point, I'm just going to open up the floor for questions.
So you did say that insurance, it doesn't cover it, right?
Insurance does not cover stem cells.
Okay.
They don't.
And the process for qualifying, requires, I assume, an MRI or something.
You should. If you have bad arthritis, you want to be able to see, is the stem cells working? So you need a before and after. It's almost like getting a before and after photo. So once the bone is touching bone, or the degree of arthritis that's in that particular joint, you want to document that. So most centers will require you to do a pre-treatment MRI, and then at the end of the treatment, 6 months into it, we throw in the second MRI. So we actually do that so you can see the difference. But throughout that process, you should be feeling better symptomatically. Your symptoms should be improving within that first 3 months after the injection.
I read that if you were already bone on bone, that doesn't work. It's too late.
No, it's never too late. Now, I will tell you that it's better when you're not bone on bone, because obviously you have room there, and the stem cell actually helps the tissue that's there to help to regrow, right? That's how stem cells primarily work. So if it's really, really bad, you're not going to get as good a result, and you may need to do another injection. But most people only need one, 99%, unless it's really embedded where there's no tissue.
All right, this is really basically for arthritis and bones, and I have neuropathy. I don't see that would be helpful.
What type of neuropathy do you have? Diabetes neuropathy? Diabetic?
I don't have diabetes. It's just neuropathy. I've had it for years.
Okay. Peripheral neuropathy? Is it in your hands, your legs?
In my hands, my feet, my legs.
And they don't know the reason. It's just an idiopathic reason.
I don't know where I got it.
Okay. Well, I will tell you that.
And it's bothering me. I've been taking Neurontin for years. And the only solution my doctor had is take more of that, and I don't want more.
Neurontin, Lyrica. Have you tried the Lyrica? All these other ones? Cymbalta. Yeah, because that's all we have is drugs for that. But if you look at the basic reason behind a neuropathy, there is a problem with inflammation of that nerve. Okay, there's a low-grade inflammation. What they're doing now with stem cells is that intravenously they're treating all autoimmune type disease, any type of immune dysregulatory activity in the body. They're giving it a try. I'm not saying that it would cure you, but it certainly wouldn't hurt. And may actually help you where you wouldn't have to take Neurontin or Lyrica or Cymbalta or any of those drugs on an ongoing basis.
So that would be the intravenous.
And that would be definitely intravenous. You wouldn't be injecting it in the skin. We would just do it intravenously, just like you do an IV.
Right.
It's for your whole well-being.
Exactly. Yeah. And you know, stem cells have the ability to go to the area of damage. They have a homing. It's called a homing. Those cells have that ability. They go to the area where the damage is in the body. When you do it, whether we inject it in that area or we do it intravenously. Other questions?
Are you familiar with the syndrome called Ehlers-Danlos?
Yes. That's a connective tissue problem. Yeah, where there's elasticity and it's stretch and yeah, I'm familiar with it. That is.
I'm here today because that's what my son has.
Your son has
My
it.
son has it.
Okay.
25 years old. He was diagnosed when he was about 12, maybe 13. No, he wasn't diagnosed. We were trying to get a diagnosis. They didn't know what it was until we finally found.
They did a biopsy?
No, they did not. Actually, he was getting physical therapy, and the therapist recognized it and asked us to go over to the genetic center at Emory.
And they picked up.
That's where he was diagnosed.
All right. I have no familiarity with stem cells and Ehlers-Danlos. I don't. I have none. But you know, I can look through the research. Oh, most definitely. I would do it. I would research it. Yeah.
Because there's so many joints and his bones just disappear.
Yeah.
He's sitting still.
Yeah.
And he would have subluxations and dislocations.
Yeah. The ligaments and the tendons are lax, so they're not doing their job. They're supposed to hold the bones together, joints together, and they're not. So everything is just lax. I'm quite aware of the condition, and it is one of those inherited conditions, and it's a genetic condition that we all learn in medical school. And it's one of those that I don't think there's ever been anyone who proposed that there is a cure for that. But if you're getting new cells, what can it, it can't possibly hurt, right? Exactly. And it goes to the area of damage. Yes?
Does this work for everyone, or are there some people that...
It works for everybody. Everybody. When you say some people, like...
I mean, is there some people maybe they have it and it doesn't relieve their pain?
I don't know why it wouldn't. If it works, we're all human beings, we're mammals, and we have the same tissue. And if we're giving our bodies stem cell that can differentiate into any cell, it should work.
Do they have to have the MRI before they come here, or can you get it?
We can order it for you. You don't have to have it, but we can order it for you, and you can get it done. Usually, we have a contact down at the cab that we usually get that done within 48 hours.
Does Medicaid pay for any of that?
The MRI, your insurance will pay for.
Medicaid will?
Medicaid will pay for an MRI, yes. Medicaid, Medicare will pay for MRIs with the right indication. Correct.
And you mentioned autoimmune, and you mentioned lupus.
Lupus. Any autoimmune disease. Perfect example. Many research on cdc.gov. There's over 10,000 studies right now on stem cells. And lots of them are being done on neurological disease, Parkinson's disease. I don't know if you guys know that Muhammad Ali and some famous people have had Parkinson's, and they've used stem cell to regrow that part of the brain. And they've had decent, Parkinson's, but multiple sclerosis for sure. it's the body attacking itself and removing those myelin sheets over the brain and preventing the conduction. So there's definitely some evidence that stem cells help with that. Yeah, for sure. Question, sir? You good? Okay. Any other questions? So we have Hope, Laura, and Shabbos in the back for any additional questions. And with that, I'm done.